Today, I will be talk a lot about something called osteoporosis. I want to give you information what are the best sources and what are the best vitamins to prevent osteoporosis. Why osteoporosis is so dangerous? What statistics say right now how many people, especially women after 50 years and older, suffering from osteoporosis? What are the consequences of not treating osteoporosis correctly? Everything in today's video. Osteoporosis is often called silent thief because it slowly steals away bone density without causing pain in early stages. By the time symptoms appear, the bones have already become fragile and prone to fractures. A simple fall or even sometimes as light as a bending over can result in a broken bone. For women after menopause, osteoporosis is especially dangerous. It doesn't just cause the pain, it can steal independence, mobility, and quality of life. That's why today I want to share with you the truth about osteoporosis, what causes it, and the vitamins you can use, a natural protection to keep your bones strong and healthy. And the main reason why you have all those osteoporosis, especially in today's modern world, first is going to be, my dear viewers, especially women after 50, is going to be hormonal changes. After menopause, you lose a lot of estrogen and progesterone, and that is one of the main reasons why you have osteoporosis, but not the only one. Also, loss of bone density with the age. After age of 30, we slowly lose bone tissue every year. Then you have calcium and vitamin deficiencies. Without enough those minerals and vitamins that you really need and other nutrients, the body cannot maintain strong bones. And of course, it's going to be lack of exercise. Weight-bearing exercise like walking and strength training is essential for the bone health. Then genetics, family history play a role in how strong bones remain with the age. Then poor lifestyle habits. Smoking, excessive alcohol, and poor diet increase the risk. And of course, my dear viewers, when you have early stages of those osteoporosis, even with small symptoms, can tell us something is wrong. Of course, you deny everything, and when you have some kind of back problem or similar kind of condition, what do, my dear viewers? Please comment below the video. After first sign of a little bit of pain or maybe a lot of pain in your back, you use chemical medication and use chemical medication each day, maybe for the months, maybe for the weeks. And after you rely only on chemical medications after a long period of time, the osteoporosis get a lot worse. Now let's continue. What statistics say? Let's look at the numbers. Statistics show how just much osteoporosis has grown over the past 2 decades. In the year 2000, around 10 million Americans were diagnosed with osteoporosis, the majority being women of the 50. In 2010, that number had grown about 12 millions. In 2020, nearly 40 million Americans had osteoporosis. And in 2025, the estimate is around 15 million women and men combined, with women making almost 80% of the cases. So we see a clear trend. Osteoporosis is increasing, and women after 50 are the group that is most affected. And that is clear, and every year after 2025 is going to be a lot worse. This is because of everything I said earlier. Now let's talk about what is going to happen when you don't treat osteoporosis on a quality and natural way. Consequences of untreated osteoporosis in women. Unfortunately, the consequences are severe. First one is going to be fractures. The most common sites are the hip, spine, and the wrist. A hip fracture can mean surgery, months of recovery, and often loss of independence. Second is going to be chronic pain. Fragile bones can collapse in the spine, leading to pain and hunched posture. Then you also have loss of mobility, difficulty walking, standing, and even performing daily activities. Of course, you will have emotional suffering, fear of falling, loss of confidence, and depression. And decreased life expectancy studies shown that hip fracture in older women significantly increased the risk of death within the following years. This is why prevention is so important and brings us to the vitamins that can make a real difference. Perfect natural vitamins in perfect natural sources with the food, with the natural remedies, with good natural supplements. You really must take this into consideration. And don't be blindfolded walking through the life thinking everything is going to be okay. I have just a little bit of back pain. And after a couple of years, you have some kind of fall, you break your hip, and then what, my dear viewers? Now let's talk about the vitamins. When we think of the bones, most people immediately think of calcium. But calcium alone is not enough. Without proper vitamins, calcium cannot be absorbed or used correctly in the body. For women over 50, the most important vitamins for preventing osteoporosis are: first is going to be vitamin B complex. The B vitamins are not often mentioned when we talk about the bones, but they play a crucial role. They strengthen proteins in the bone structure. They support production of progesterone, a hormone that indirectly protects bone mass. They regulate homocysteine levels in the blood. High homocysteine is associated with bone weakness and a risk of fractures. Recommended use: follow the instruction of the B complement supplement packaging. B complements together are unbelievably important. A lot of you don't realize it for the osteoporosis, but I'm going to recommend you use vitamin B complex as recommended on the supplements that you buy. Then add a little bit more of vitamin B6 or pyridoxine. This is essential for metabolism amino acids, which are building blocks of proteins, support collagen formation. And collagen is the flexible framework on which minerals like calcium are deposited to form strong bones. Vitamin B6 helps regulate homocysteine, lowering fracture risk. Recommended dose is going to be 100 milligrams daily, but only under medical supervision. My third recommendation is going to be vitamin B12 or cobalamin. Vitamin B12 support red blood cells production and nerve health. Plays a direct role in DNA synthesis and bone cells. Like B6 is lower homocysteine level, reducing risk of brittle bones. Recommended daily dose is going to be 500 to 1000 micrograms daily in agreement with your doctor. So this is information about the vitamin B that you really need each day. But this is not only vitamin that you need each day. Of course, you need everyday vitamin D and vitamin K. Vitamin D right now, like 90%. Everyone, especially women after 50, are in very vitamin D deficiency each day. That's why you need to take it vitamin D each day. How much? Probably a couple thousand international units daily, 3,000, 5,000, maybe 10,000 international units daily, because you are on a high risk of high risk of the osteoporosis. That's why you need vitamin D each day. And of course, vitamin K is often forgotten, but is essential for the bone production and protein production in the bones. Vitamin K activates the protein called osteocalcin, which binds calcium to the bones. Prevents calcium from depositing in the arteries instead of the bones. Recommended dose is going to be 90 to 120 micrograms daily. How these vitamins work together? Imagine your bones as a house under construction. Calcium is the bricks. Vitamin D is the worker that carries the bricks inside. Vitamin K is the cement that fixes the bricks into place. And vitamin B complex, vitamin B6 and B12 are the engineers that design and strengthen the structure, ensuring the building is strong and resistant. Without all of them working together, the house or your skeleton cannot stand the firm. And this is unbelievably important, and those is a recommendation when you take supplements form every day, in the supplements form like pills or tablets or whatever. But even better is going to be for you, think about what you eat each day. That's why I'm going to give you the list of the food sources that contain all of those vitamins that you really need to write and down somewhere, and try remember it, and you try eat each day some of those food, of course. Supplements are helpful, but food should be your foundation. Here are some of the best sources. Food high in vitamin B complex are beef liver, eggs, salmon, chicken breasts, lentils, chickpeas, spinach or mushrooms. Food rich in vitamin B6 and B12 is going to be tuna, turkey, Greek yogurt or sardines. Food high in vitamin D is going to be fatty fish like mackerel, fortified milk and the cereals. And food rich in vitamin K is going to be leafy green, kale, broccoli and Brussels sprouts. By combining those foods daily, you naturally give your body the tools it needed to keep your bones tough. Practical lifestyle tips for stronger bones. Walk at least 30 minutes every day. Do light strength training twice a week. Lifting even small weights strengthens the bone. Spend 15 minutes in the sunlight for natural vitamin D. Avoid smoking and excess alcohol, they weaken the bones. As I said it 1,000 times before, this is crucial, my dear viewers. You really need to understand what is the healthy way of living, what are the natural remedies, and then you can implement it in your life. Unfortunately, that is in my praxis almost 99%. You don't realize any of those. You eat what you want to eat, you drink all those chemical medications, you are overweight, you are overstressed, you are after menopause, everything breaks down. And that's why is in the last 20-25 years is unbelievably rise of every diseases of modern world, especially all those diseases that is connected with osteoporosis, arthritis and similar kind of conditions. Osteoporosis may be silent, but it's not untreatable. With awareness, the right lifestyle, and the help of vitamins, especially B complex, B6, B12, vitamin D, and vitamin K, you can build strong bones and prevent fractures. Think of it as investment in your future. Every vitamin you take, every healthy meal you eat, every walk you enjoy, all of it adds up to stronger bones, more freedom, and happier, healthier life after 50. My dear viewers, I'm going to give you for the last part of the video. I worked with the patients with osteoporosis for almost 26 years. My specialty is going to be nutrition, natural remedies, physical therapy and rehabilitation. And if you want me to take care of you in the safe and natural way, call +385 9891 79200. Call my Mario Lab Center in Zagreb, Croatia. You have two options how I can help you. First one is going to be come to my office, and I will do everything in my power to help you. And secondly, you cannot come to my office, this is totally fine, then we arrange a phone consultation. In every way that you can imagine it, I will be making perfect natural remedies program special for you. I'm on arrange healthy lifestyle with best natural remedies for any disease that you have. Even more, I will send you the best natural remedies directly at your home address, and you will have that detailed plan how to prevent osteoporosis or any kind of problems with the safe natural way, without any chemical medication, with any kind of injection or I don't know, like operation. Everything must be safe, it must be perfect for you. This is my specialty. I work with thousands of people all around the world each year. I believe I can help you a lot. Thank you for following me, my dear viewers. God bless you, God bless your family. See you in the next video. Bye bye.